Good afternoon, everyone. Thank you all for joining us today in person and online to learn more about the temporary accommodation here at the Edmonton Convention Centre. I'm Glenn Kubish. I work for the City of Edmonton. We acknowledge that the land on which we gather today is the traditional land of Treaty 6 territory and the traditional Métis homeland. Now, you'll hear from each of the people standing up here. They're safely distanced, but really standing shoulder to shoulder in the work to make this project work for the people it's designed to work for. The partners have their own brief messages. Together, they partner in the story of Edmonton. What we create as a community connects people to what matters to them. Jackie Ford leads Social Development Branch at the City of Edmonton. Dean Kirpue-White is the Executive Director of the Mustard Seed. Gary Saint-Amand is the CEO at Bissell Centre. Jordan Reiniger is the Executive Director at Boyle Street Community Services. And Cheryl Whiskey-Jack is the Executive Director at Bent Arrow Traditional Healing Society. After they speak, we'll take questions, first from news reporters here and then from those joining us remotely. And then for those here, there'll be time for a quick tour of the facility to see how it will work. Here's Jackie Ford from the City of Edmonton.
Thank you, Glenn, and good afternoon, everyone. Thank you for being here in person and online. It's great to be here today. The pandemic has brought about many unprecedented challenges for a lot of Edmontonians, and it has had a particularly devastating impact on people experiencing homelessness in our city. Currently, there are 2,000 people in Edmonton without permanent homes. An estimated 600 individuals sleep outside or are unsheltered at any given night, and it is estimated that over 200 Edmontonians are now becoming homeless every month. While the pandemic has increased the number of Edmontonians who fall into homelessness each month, it has also created a gap in the services and spaces that are available for individuals, both overnight and during the day. Over the past several months, some individuals have turned to encampments like Camp Pekawaywan in Rossdale and Light Horse Park in Old Strathcona. We all know that tents are not a long-term solution to homelessness. And in the midst of a second wave of the pandemic, they are not a short-term solution either. In response, the city has been working with Boyle Street Community Services, Mustard Seed Society, Bissell Centre, and Bent Arrow Traditional Healing Society to open the facility in which we stand today. A temporary 24/7 low barrier accommodation right here at the Edmonton Convention Centre. The facility will open tomorrow afternoon with space for 100 people overnight and during the day, and will scale up by the end of the week as the agencies continue to hire staff. And next week, we expect them to accommodate 300 people overnight and 300 people during the day. While we are still working on the logistics, starting next week, Edmonton Transit Service will provide charter bus transportation to help those living in Camp Pekawaywan to relocate to the available temporary accommodations of their choice, including the Edmonton Convention Centre. Boyle Street Community Services is also continuing to work to transition individuals at Light Horse Park into bridge housing on the south side of the city. At the Edmonton Convention Centre, people will have access to a safe, warm place to sleep, as well as health, wellness, and other supports designed to help them find stable housing. Intake procedures will include COVID-19 screening measures to ensure the safety of everyone on site. It is important to note that this accommodation is not meant for long-term stays. The on-site outreach and housing workers' roles will be to focus on connecting as many people as they can with housing plans as they are supported on their path into permanent housing. Increasing the supply of affordable and supportive housing was one of the city's top priorities before the pandemic, and COVID-19 has made this need even more crucial. Operations at the Convention Centre are just one of the ways we're working to ensure all Edmontonians have a warm place to stay this winter. The city is also working with the Government of Alberta and Hope Mission to provide space needed to operate a temporary shelter at Commonwealth Stadium, which will accommodate more than 100 people. On the south side, the Mustard Seed is opening a 24/7 shelter at Cesco. Additionally, a hotel on the south side and bridge housing in Northlands are expected to open up in the next couple of weeks. With all these accommodations coming online in a very short time frame, I may add, there are more than enough indoor spaces for folks who are sleeping rough to come in from the cold and receive services that will lead to more permanent housing. Beyond these accommodation efforts, the city is supporting our most vulnerable by increasing the supply of monthly bus passes available through the Providing Accessible Transit Here program. The program is called PATH. The number of passes for the PATH program will increase from 600 passes per month to 1,900 passes per month. These are no-cost passes specifically for people who are homeless or at risk of becoming homeless. A number of social agencies work with people to transition PATH recipients to the low-income pass as they get back on their feet with housing and income supports. I want to extend the city's absolute gratitude to our community partners, Bissell Centre, Boyle Street, Mustard Seed, and Bent Arrow. Their work and continued efforts to support our city's most vulnerable and help move toward ending homelessness in Edmonton cannot be overstated. The speed in which this accommodation went from a plan to an operational site has been astounding. And in a truly Edmonton collaboration, the Government of Alberta, Alberta Health Services, and of course the Edmonton Convention Centre stepped up to ensure that people experiencing homelessness will have access to the services they need in this extraordinary time. We are very grateful to everyone involved. Working together, we will continue to provide an integrated, comprehensive, and compassionate approach to help fellow Edmontonians get through these challenging times. Thank you.
Jackie, thank you very much. Let's hear from the partners you mentioned. Here's Jordan Reiniger. He's from Boyle Street Community Services.
Thank you. I'm a little bit taller, so I gotta push this up a little bit. So Boyle Street Community Services is incredibly proud to be part of this initiative with our partners, the City of Edmonton, Bent Arrow, Bissell Centre, and the Mustard Seed. And in particular, we want to thank the City of Edmonton for their leadership in standing up such an important service for our most vulnerable neighbors during this incredibly challenging time. The folk we all serve are in a precarious situation. Winter is fast approaching, COVID case numbers are rising, and the opioid crisis continues. At the same time, AHS guidelines limit capacity at places in the community people rely on. For instance, Boyle Street's usual capacity at our downtown community centre in the winter is over 300 people, but now sits at just 45. All of this has a disproportionate impact on those experiencing homelessness, particularly those who are sleeping rough. With respect to our specific role here, Boyle Street will be the first point of contact for people entering, including doing COVID screening and an initial intake and assessment. And the main objective here is to understand people's needs and connect them to the services possible on and off site. Our team is also providing medical support. We're going to have a team of nurses, LPNs, EMTs to do basic assessments, wound care, foot care, and referrals to other medical supports. Given the significant risk for those accessing the convention center face due to the opioid crisis, we're also going to have a 24/7 opioid response team. There'll be medical professionals who are capable of intervening in the event of an overdose. Finally, and significantly, we have also confirmed as of this morning that the convention center will have an overdose prevention site, which will be sanctioned by a ministerial order of the province. Boyle Street's existing supervised consumption site, currently at our downtown community centre, will be temporarily closed and relocated to the convention centre. This relocation is in response to where we see the most significant need for these services in our community, and we're going to begin to transition services to the convention centre over the next 2 weeks. Finally, I just want to take some time to thank the team at Boyle Street and all of our partners. People's true colors come out in a time of crisis, and I'm overwhelmed at how incredible the team from all of our agencies have been in standing up this in such a short amount of time. Their commitment and dedication to those we serve is truly remarkable, so I want to thank everybody who's been part of that.
Jordan, thank you. Please say hello now to Gary St. Amand, who represents and leads the good people of the Bissell Centre.
A little bit of a height difference here. Well, thank you very much, and I really appreciate the strong commitment from the city and our partners to work collectively together to provide this important service in the community. Bissell Centre has been working with our community for over 100 years to ensure that people who are experiencing poverty and homelessness in Edmonton are able to access critical services that will allow them to move forward in their journey. And when we are able to work together on initiatives like this in a collective manner, it allows us to really provide significant resources and accomplish things collectively that we would be unable to do individually. Bissell Centre is responsible for the day shelter services on site, which will allow people to access basic needs, food, clothing, and other critical services, as well as is responsible for the housing that will be provided here on site. That does not mean that Bissell Centre will do all of the housing. That is just ensuring that the coordination and the efforts are there. The work of housing in our community is a collective effort that all of the partners here represented are engaged in together. And so we just want to ensure that we are maximizing those efforts and providing an opportunity to capitalize on all of the contributions that are existing in the community. I also want to echo Jordan's statement that this doesn't happen without our employees who work diligently and give of themselves really in a completely loyal way to the work that we do and to the people that we support. And so a huge thank you to our teams who have put in such a tremendous effort. Thank you.
Gary, thank you very much. The good people who serve at the mustard seat are represented now by Dean Kirpywhite. Dean?
Good afternoon, everyone. The Mustard Seed has been providing overnight shelter services for a number of years, and we're pleased to be one of the partners, and that will be our role to provide overnight shelter services here. We feel that our job is really quite simple, to not only provide a safe place for people to come out of the elements and to be physically warm, but also to provide a place that is safe and emotionally warm. And we will do that to the best of our ability to make sure that everybody that comes to us knows that they are not just here to receive a service, but they're here because they have value, because they're important, and because we want them to know that they are loved. And so each and every night, that is our goal, to provide not just a physically warm place, but an emotionally warm one. We are so pleased that we can be in partnership with the City of Edmonton, which has shown just extraordinary leadership during these difficult times, but also to collaborate with such amazing agencies in Boyle Street and in Bissell Centre and in Bent Arrow. You know, one of the things that I think goes unnoticed through the community at large is how us as inner city agencies really lean on each other. And this is a great example of how our collaboration over the years is coming together to pull one major thing together. And we are just thrilled to be a part of that and to work with such incredible partners. So we look forward to the coming months in the sense that we look forward to being able to help those that need our help, and most importantly, as much as we can, to house those that are homeless.
Dean, thank you very much. The next incredible partner is Bent Arrow Traditional Healing Society. Here's Cheryl Whiskey Jack. Welcome.
Good afternoon. I'm so grateful to be here today to work alongside colleagues who understand that access to culture, land, and ceremony is not a perk or an add-on, but is integral to the work. I'm grateful also to be able to work in a city where we come together, work together, create together, innovate together, and we do this continually so that when need arises, we are able to mobilize so quickly. All four organizations here today, plus the City of Edmonton, have relationships with each other that predate this initiative. The flurry of activity and planning in a very short time is nothing short of extraordinary. Bent Arrow has an established and thriving cultural team called Practice as Ceremony that has been working hard to mobilize access to cultural support services to anyone accessing the services of the winter shelter here at the Edmonton Convention Centre. We will begin our work by building relationships and asking what services the people accessing the shelter program would like. We will implement daily smudge, morning and evening for staff and community who wish to participate. We will offer elder supports such as one-on-one as well as elder teachings. Other thoughts include sharing circles, healing circles, women's circles, and other ceremonies. We will also provide opportunity for a creative process through teachings on Indigenous crafts. Perhaps language introduction is something we could do. All these ideas we will evolve with at the guidance of the community accessing the centre. As we are in the centre, these services will change, grow, and evolve depending on the needs of the participants. We are working hard right now on recruitment and contracting of services to meet those needs. We look forward to serving our most vulnerable, as well as deepening partnerships through this work. Miigwech.
Cheryl, thank you very much. Let's take some questions from reporters in the room. Please identify yourself and your outlet. Now, the reporters and our audience should know that the questions may not be able to be heard by those following on the live stream, so I will do my best to accurately repeat or paraphrase for those answering the questions. Jeremy Thompson from CTV Edmonton, thank you.
Yeah, well, thank you for identifying me for me. A quick question, I think, for Jackie, just about the funding. Of course, you sort of break it down in the news release here, but how much is all this costing and where is it coming from?
The question, Jackie, is how much this is all costing and where's the money coming from?
Thank you for the question. The budget for this space is $8 million, and it is coming from a grant it's a federal provincial grant that was given to municipalities that was designed to lessen the impacts of COVID, for operating costs for municipalities that they had to incur because of COVID.
And it says in the release $8 million plus some funding from the city's budget as well, hey? It says in here $8 million from that federal and provincial governments, and then an additional $500,000 from the city's 2020 budget.
Yes, yes. So the $8 million is that the $500,000 is from city budgets. Primarily, I'm going to guess from my budget, social development, but there's other parts of the city that are contributing as well.
Quick follow-up.
We'll come back if, sure, go ahead. Follow it up.
And
You've got the mic.
Just for Jason, actually, with Boyle Street, I wonder if you might tell us more about this decision to move the supervised consumption site from Boyle Street to here. Tell me more about that, and I understand there's currently an end date of, when the shelter wraps up at the end of March. What happens after that?
The question is about the reason for moving the supervised consumption site from its current facility or location to here and its timeline.
So yeah, the rationale was really around the need to have an overdose prevention site here. The reality that the capacity here is much more significant than we have at our community center, given the restrictions around capacity. And so, we have always maintained that as an agency, we go where the need is, and so this is where the most significant need is. It's definitely a bit of a trade-off, but we feel like this is where those services ought to be, given the landscape that we find ourselves in right now. The contracts for supervised consumption do end at the end of March, which sort of aligns with the end of this. We don't know what will happen beyond that, but we do have a commitment from the provincial government that service levels, the existing supervised consumption service levels, will not be decreasing after March. And so they're going through a process now of reviewing what those services will look like exactly over the term of the remaining contract. But we have the commitment from them that it won't be decreasing service levels.
Dustin Cook from Post Media. Welcome.
Hi. Probably for Jackie. I'm wondering, what does this mean for the future of Camp Pekawewin? Has there a date been set for its removal? And what is the city doing to encourage access, residents to access these services?
Jackie, the question is what happens with Camp Pekawewin and the question of access to these services.
Hi, thank you for the question. We're in discussions, active discussions with the folks at Camp Pekawewin, and we're looking at next week. We're still working out the logistics for those folks who want to come to this shelter or to any of the other shelters, Mustard, Hope. So that service will start next week. And at this point in time, we expect that the organizers and the outreach workers who are working there will provide information to the residents to let them know what their options are.
Follow-up? What is the screening process for COVID-19 and what action is being taken for health and safety in regards to that?
What is the screening process for COVID-19? Jordan, will you handle that one?
So we follow all the AHS guidelines around screening. So before somebody comes into the facility, or once they're about to access the intake, they'll go through the questionnaire that we'll walk them through, usually just verbally, ask them the questions, and then we will, there is a temperature check, and then if anybody has symptoms, then we have a process to sort of divert them into an isolation space until we can get them to the appropriate facility.
Did that answer your question, Dustin?
Yeah.
Very good. Sarah Kobadina is from Global Edmonton. Welcome. Your question, please.
Thank you. I wanted to ask about the decision to open Commonwealth, especially with the Convention Centre opening. Why was that decision made? It seems that a lot of people, even Councillor Scott McKean, were blindsided by that decision.
Jackie, do you want to take the question about why Commonwealth is also, or portions of it also being opened in this effort?
Yes, thanks for the question. Some of you may recall that during the last few months, the city has been supporting Hope Mission to operate an overnight shelter at the Central Lions Centre. With the folks who use that centre wanting to get back to their routine, Hope Mission approached the city and said, where can we put this overflow site? So we looked, and I think everyone in this space and in this sector knows it's been really difficult to find space that's large enough to host or to serve those populations overnight. So right now that site is overnight. We're working with community, with Hope Mission, and to determine whether we're looking for a plan that would serve the community and the folks who are there for a 24/7 operation of that site.
But again, community members and even the Councillor Scott McKean said they were kind of blindsided by this decision and weren't aware that the city was moving ahead with this. Why wasn't there consultation with the community, or it seems like it was almost done in secret, so to speak?
I would say that things are moving at a rapid pace. There are decisions being made all the time. The need for that shelter, that once it left Central Lines, was there. We needed to have a space. I can say that sometimes when you're dealing in what feels like a crisis, you might miss some communications that we should have had, and I will take full responsibility for Councillor McKean not knowing about that site. But I also want people to know that there is right now the plans for 24/7 are happening. It has not yet been verified, but right now that site is operating just like it did at Central Lions, where people come in, they don't walk in, they have to go through the whole process. They're taken there by a bus, and then when the morning comes, they're taken out by bus. So as that plan evolves, we will engage the community.
And I just wanted to ask too, with the centre opening tomorrow, do we expect to see homeless encampments shrink, or more people utilizing these spaces overnighting it out in the cold, or what are you expecting to see with when it comes to those large encampments?
So now that we know this site is open tomorrow, we will be working with the folks who are living in the camp and organizing those camps, both north and south side, to encourage people to come up here, because we do know there's much better services. A tent is not a good place to be in a winter, and it is certainly not a good place to be during a pandemic. So we will be encouraging those folks to take shelter indoors with all of the various options that we have available now.
One more question.
Just when it comes to some of those concerns with people that are sleeping in tents, sometimes they have the concerns about sleeping in a large room like the conference center, with the bedding being closed, they feel they may not have that freedom. How can you convince some of these people that feel that just sleeping in a tent is better to come and utilize these services?
The question is, will you face any kind of reluctance when you try to convince people living rough or living at the camps to relocate to something more formal?
That is always a risk, and we do know that all those folks who are living in camps or in other places in our city have agency over where they live. What we're trying to do with our outreach workers and with the information we're providing to them is to let them know that groups just like the one standing behind us and also the other service providers in the city have services that will help them become in a better position to go into permanent housing. You're right, there will be some hesitancy from some. It will be up to us and the service providers to show them that it is much more beneficial for them to be indoors than outdoors.
Jackie, can I just ask a clarifying question? When you talk about Commonwealth Stadium as a shelter, can you pinpoint what you mean when you use that big term, Commonwealth Stadium?
It's not. It's a section of the facility that is. You asked me a question. I'm not exactly sure 100% exactly where it is, but it is not the entire facility. It's a small space along one of the concourses that will be designed. That HS has looked at to ensure that there's enough spacing in there, and it will be a specific space for them. It isn't the entire building.
Good. Thanks for that. Can we try an online question? I believe that Natasha Reeb from CBC is with us.
Yes, hello.
Hello.
Jackie, sorry, it's probably for you again, sorry. Okay, so we have an estimated 2,000 homeless or experiencing homelessness, and the city's done a tally for me that these spaces can accommodate approximately 700 people. So I know it's very impressive, but I'm kind of wondering what the rest of, the 1,300, sorry to put a number on it, but where do they fall into this scenario?
So the question, Jackie, is you don't have enough space here for everyone who is homeless.
That is absolutely true. If you're looking at just shelter beds, and we are on, just so you know, there's about 700 shelter beds right now. This will add another 300 capacity for overnight and during the day. And I'm trying hard to do the math, but we also have to recognize that there's bridge housing options that are opening. There's the one at Northlands, the Coliseum Inn. I believe that there are agencies right now who are in the process of purchasing or leasing hotels for this purpose. And we also know that there's one on the south side as well, a hotel coming on stream. So is there exactly 2,000 spaces? Probably not. But we also expect during this time, because our focus is housing, that people will be moving into permanent housing as they move through the shelter and temporary accommodation system and go into permanent housing. And I'd like to just credit all the work that's gone into this file since the pandemic started. I think it's a story that we don't tell enough, that well over 1,000 people have been placed into and accessed permanent housing during the pandemic. So we don't expect people to just stop in one space and then not go. So there'll be some fluidity within those numbers and within those spaces.
Great, thank you so much for clarifying that. And in the press release, it says an estimated 200 people are becoming homeless each month. And that's based from what, the beginning of the pandemic? And how alarming is this?
Go ahead, Jackie. Natasha, could you repeat your question while we sort out your answer?
Yes, sir. So it's an estimated 200 people more are becoming homeless a month. How alarming is that number? And is that based on COVID? Is that because of?
Yeah, I think I can answer part of that. It is an alarming number for sure, and I think that's something that we have understood when we think about the eviction protections that were put into place and other benefits that have been available to people that have been vulnerably housed. When those protections start to disappear, we understand that the impacts that those have, as well as obviously the economic impacts that go alongside that. it really is a situation that we need to pay attention to. And I think one of the conversations that we are working on as a community is not only how do we help provide intervention for the existing folks who are experiencing homelessness, but as well, how do we think about prevention and the work that we need to do in terms of helping folks stay out of homelessness in the first place. So I think that's really the critical focus. For sure, I think, just from our perspective, the impacts of the pandemic have been significant and have exacerbated an issue, but it was an issue that was going on prior to the pandemic. So I hope that answers your question.
Yeah, okay, thank you.
Are there any other questions in the room? Jeremy?
Question for Cheryl, if I could. You listed off a bunch of the sort of cultural services that are going to be available here. Just wondering if you could talk a bit more about how important that is to have that accessible here and what that will actually mean for folks. How meaningful will that be for folks to have access to when they're in a space like this, a formal space like this?
Cheryl, talk about the importance of the cultural supports that people will experience here.
Yeah, so it's for me a real moment as an organization and an Indigenous service provider here in the city to come into an initiative where that was an immediate thought that was put into the funding structure. It's one of the first times I can really think of that that was really just integral to the service that was going to be provided. When you look at there's going to be a large component, like group of Indigenous people who are obviously going to be accessing the center. And access to culture, land, and ceremony is one of the factors that leads to many of the issues that they're facing today. So it's a byproduct of historical trauma, and these are ways to incorporate healing and wellness back into their lives and could be the start of something. And it's something that is not an afterthought for a change. And these are, the things that I listed are a suite of things that we are already providing. It is by no means something that we're going to sort of prescribe, but we'll take our lead from them for sure. Yeah, thanks.
Good. Dustin?
Hi, for Jackie again. Jackie, on the transit passes, I'm wondering, has that been budgeted? And is this just for 1 month, or how long is it going to be 1,900 passes being given out?
Explain the transit passes, whether they're budgeted, and the timeline for that new service.
We are actually, the passes will be available starting November 1st. They're distributed through social service agencies, so we're going to have to work quickly with them to make sure that they get all the supply that they need, and it will be an ongoing budget requirement.
The plan to make it long-term, though, so not just for this month, not just for the winter, but is there a timeline on this?
That is the plan, is to try and make it permanent. The funding for those passes will come some from the city budget, but also, and I'll have to get back to you with the details, I believe there's a provincial funding for the path passes as well, but I'd have to verify that, Dustin.
I have one quick one, a little bit different subject. Are the existing shelters before these temporary shelters staying open? So if that's about 700 spaces, is this doubling the amount of spaces for shelters overnight?
Our existing shelter space is staying open while this effort is mounted.
Dean, do you want to take that? I'll let my colleague answer that one.
Thank you, Dean.
So existing shelter spaces stay
Right,
open?
there are existing shelter spaces right now.
Yeah.
Do they stay open?
Yeah, our existing shelter spaces are all staying open. In fact, if anything, we're trying to add more spaces for individuals. The fact is, and I think it was Natasha that pointed this out, the need is really running a little bit ahead of the spaces that we have. So we need to be prepared to scale up, not scale down.
Okay, good. If that is a wrap on questions, all that's left to do is say thank you. Thank you to our speakers. Thank you to the news media. Thanks to those watching and listening, and to those helping with translation, Kevin Kolp and Alicia Ponciano. And of course, thank you to our hosts here at the Edmonton Convention Centre, led by Arlindo Gomes. Good afternoon, everyone.